Hi, my name's Caitlin, and I'll be demonstrating the different ways to administer medication. The first way we have is PO, which means by mouth, and some things that they have are single dose containers, which you would pop right into the cup. We also have from a pill bottle. Never want to touch the medication. You would open the cap, pour the medication into the cap, into the cup. You would want to check the expiration of the medication. You would want to check the patient's chart to make sure that you have the right patient, the right time to deliver the medication, the right medication, also the right order from the doctor, the right route, and the right dose. If you were to ever make a mistake, you would immediately assess your patient and then report it. We also have the patch, which you want to choose an area of the skin that is free from hair. You could use a razor to remove the hair. You'd peel the patch back, being sure not to touch the sticky part. You want to wear gloves with this. Place the patch on, hold the patch for 10 to 15 seconds. You want to put the time, the date, and your initials. An inhaler would also be a medication. Some people use a chamber. You would have them blow out their air, and then as they inhale, to push the button down, and then rinse their mouth out after they're done. The other medication would be eye drops and ear drops. You could, you have them sit back, you pull their eye down, drop it in, being sure not to touch the dropper to the eye, and then you could massage the top of the eyelid, and you don't want to rub your eye too much. You could use a tissue to pat the eye if any of the medication falls out. Along with the ears, tilt their head to the side and drop the drops into the ears, have them hold on one side, making sure that all the medication stays in. You could also put a cotton ball in. Okay, now I'm going to demonstrate different needles to use for different kinds of medications. It depends the size of the patient. If they're a smaller patient, you wouldn't want to use a gigantic needle. If they're a larger patient, you wouldn't want to use a small needle. Also the site of the injection and the kind of medication that you're giving. So the first kind of medication that I have here is insulin. You want to make sure that when you're administering the insulin, that you have another nurse check. You also want to use an insulin needle, which has an orange cap on it. The needle is, there's 3 different places to place the insulin. You could do 2 inches around the umbilicus, which is your belly button, and you would want to pinch. Also, you could use your deltoid muscle, which is over here, pinch the skin, and then you can also use your thigh, which is your vastus lateralis. How to administer insulin would be, I would put gloves on, and I would take the cap off. Now for this medication, we have the fast-acting insulin, and then we also have the long-lasting insulin. You want to make sure you roll those medications in your hand to mix the long-lasting, because there's sediment at the bottom, and that's part of the medication. To draw up insulin, or any kind of medication that's in a vial, you want to make sure that you check to see how much insulin that they need. Okay, check the order. And say they needed 5 units of fast-acting and 10 units of long-lasting. You would pull the plunger down to the 5 unit, and you're going to, the 10 unit, because you need 10 units of the long-lasting. I'm going to pull down, and then you're going to stick it into, this is after mixing. Stick it in, plunge down the 10 milliliters, pull back to the 5 unit, and stick it into the fast acting, and then you're going to immediately turn it over and pull up 5 units, making sure that there's no air bubbles. If there are air bubbles, you can push the plunger back in, but not with the second one because you already have medication in this one. Okay. Then you would take the long-lasting one and push the needle in. And this one you want to make sure that you go slow because you don't want to go past the 10 unit mark. And I would suck up to the 15 because this one I needed 10. Okay. And then I would take the needle. I would pinch the skin depending on which part of the body they need it on. At a 90-degree angle, let go. And administer the medication, pull back, and immediately dispose it into a sharps container. Be sure not to rub the area as well. Okay, and you don't want to recap the needles. You can use the scoop method because once it's been in the patient, could be at risk for different kinds of infection. Into the sharps container. Next we have, well, you also want to make sure that when you're doing that you use an alcohol pad to clean the tops of the vials. The next kind of medication that you can administer is also is intradermal, which goes right into the muscle. The 3 locations are the deltoid, the ventral gluteal, which is your bottom, and then also the vastus lateralis, which is your thigh muscle. Rip this open, wipe the top of the vial. Okay. Needle with the plunger. And like I said before, depending on the size of the patient, you would have to use a larger needle or a smaller needle. Usually you go with a 25 gauge, 5/8 inch. This one you push on and screw on. Okay. This one has the safety feature, so once you're done with the needle, this covers the needle immediately. The same thing, flip this back. Okay, you have to administer this one, take the cap off. You can say they needed 2 milliliters of medication. You would pull the plunger back to the 2 milliliter mark, stick the needle into the vial, plunge the air in, flip it over, and see how there's some air bubbles in there? You can push to get the air bubbles out. And you pull back to the 2 milliliter mark. Okay. Flick the needle to get the bubbles out. Okay. And then with a intramuscular or subcutaneous, you also want to hold it like a dart at a 90-degree angle. Quickly administer the medication. And immediately pull out. Now this one has this special feature. You can flip it up and it automatically covers the needle. You throw the needle into the sharps container. And we have another kind of medication. Medication can also come in an ampule, which is a little glass vial. Certain medications need to be placed in an ampule to protect them from light. Sometimes medication forms at the top of the ampule. You can just tap that down, making sure to get all of the medication down to the bottom of the ampule. You want to take your gauze and break away from the body. Because this is glass, it's going to go immediately into the sharps container. Okay. And then, because this was in a glass container, you need to use a filtering straw needle. It's flexible, it's a plastic, it has a filter inside. You're going to attach that to your medication, to your plunger and needle, and you're going to stick it in, and then you can tip this medication upside down because it's vacuum sealed, and you just want to suck out the medication. Being sure not to break that seal. Okay. And that would go into a sharps container. And then you could untwist that. And then you would then, depending on, like I said, the size of the person, the patient, add your specific needle. Okay, you want to make sure that there's no air in the syringe. Perfect. Okay, and then you would 90-degree angle, administer the medication. And the last one that we have is the, it's a very small needle. It's a tubercular needle. This is used to do TB tests and allergy testing. It's administered right in the arm. And then you want to make sure that cap comes off. And you're going to pull back the amount that you need. Say that we need 0.2 milliliters to place the syringe in, push the air in, and I'm going to take out 0.2 milliliters. Okay. You want to make sure that you prep the skin, starting on the inner, cleaning to the outer in a circular pattern. Take the cap off. And this one you're going to want to administer at a 5 to 15 degree angle, right under the first layer. And as you do it, you're going to want to see the bubble underneath the skin. You don't want it to do that. Normal skin won't do that. Administer the medication right underneath the skin. This special needle has a safety device that will go right into the sharps container. When you administer the TB testing, you want to make sure that you circle the area. And then, like I said before, the 6 rights, you want to make sure that you're checking you have the right patient, the right time, the right dose, the right medication, the right route, and the right order from the doctor. And make sure you do your 2 checks when you go into the patient's room. You provide your privacy. You make sure that you check their date, their name and their date of birth, 2 identifiers, and then give them the call light. And then one thing I forgot to mention is you want to make sure that you ask them if they have any allergies, because some medications can cause an allergic reaction, and you wouldn't want that to happen to your patient. And that's all. Thank you.